Nancy Patel. I'm part of the Honors Mentorship Program, and I currently intern at Peach Clinic with Dr. Monal Shah, who's a pediatrician as well as a pulmonologist. So for my research question, I thought it was best to have my question revolve around pulmonology because I would get the best knowledge from my mentor. So my essential question is, in children, adolescents, adults, which diagnostic tests are optimal for ruling in the diagnosis of asthma in general? I've been interested in asthma because it's a disease that doesn't have an actual cure. And I've got to visit some of Dr. Monal's pulmonary patients and some potential ones who think that their children have asthma. And I always thought the process of diagnosing asthma was really interesting because not that much attention is shed on it. So I thought researching the process of diagnosing asthma was really interesting. And so before I got into my research, I knew what asthma was. I knew it was the inflammation of your air lungways, which obstructs you from breathing properly. And I knew medications such as Q-Bar were used to contain your asthma. And so for my research, I used many medical journals, including the journals from Mayo Clinic and Cleveland Clinic. And I also interviewed my mentor to get an insight on her perspective on what diagnostic tests she would utilize. And so in conclusion, the top 3 tests that I concluded with that were the most optimal for diagnosing asthma were the spirometry test, the peak flow measurement test, and the methicolline challenge test. So spirometry is a standard office test used to assess how well you inhale, how well you exhale, and how fast you inhale or exhale. Spirometry is also used to diagnose asthma, chronic lung obstructive disease, and other breathing problems. Spirometry can also be used to periodically check whether the treatments that you were assigned for your asthma are working or not. And so here I have a video of the spirometry test being demonstrated.
Sometimes doctors need to find out how well your lungs are working. This can be done with a machine called the spirometer. A spirometry test may be done in a hospital or doctor's office. Here's what happens. Spirometers have a tube or mouthpiece that you blow into. To help you do your best, a soft plastic clip will be placed on your nose so no air leaks out while you're blowing. It doesn't hurt. You'll be shown how to blow into the mouthpiece. It's kind of like blowing into a party horn for a long time. When you're told to, take a deep breath in and blow out as hard and as long as you can. That's all there is to it. Now your doctor knows how much air your lungs can hold and how fast the air moves when you blow out.
So the peak flow measurement is a quick test to measure the air flowing out of your lungs. Peak flow measurement can show the amount of air you breathe in and breathe out. And the analysis should be started after a full lung inhalation. So the goal of the peak flow test is to show early symptoms of asthma in patients. And here I have a video of the peak flow measurement test being demonstrated.
Slide the marker or arrow on the peak flow meter to the bottom of the numbered scale. Stand up straight. Take a deep breath. Put the mouthpiece of the peak flow meter into your mouth, tongue down. Close your lips tightly around the mouthpiece. In one breath, blow out as hard and as quickly as possible, like you are blowing out candles on a birthday cake. The marker should move along the numbered scale. Note the number in your peak flow diary. Thank you for viewing this video from the American Lung Association.
So the methicolline challenge test is performed to evaluate how responsive or reactive your lungs are to the environment. It can also be used to help your doctor evaluate whether you have asthma symptoms like difficulty in breathing, chest tightness, and things like that. And it can also help your doctors diagnose whether you have asthma or not, which is the third most effective test, is the Maillé-Blanchard test. And here is a picture of the test being performed by a patient. So in conclusion, I feel my research can be effective for potential students who want to specialize in the pulmonary field, or for patients, for parents of potential asthmatic children who want to understand the entire process of being diagnosed and the tests involved and what are the most effective tests. And I feel like in general, this research has allowed me to gain a new insight on the process of diagnosing asthma, because not a lot of attention is brought upon this topic.